Today we have an opportunity to hear two presentations and one comment statement, and after that there will be also possibility for discussion. And we'll start with perspective of Europe. We have first here Lydia Lazeri, did I pronounce it correctly? All right, who is a regional advisor for mental health at the WHO Regional Office Europe since May this year. She leads the mental health team with activities in mental health policy, advocacy and promotion. And now, please, you have the floor.
If I can have the presentation, please. Thank you. So I have been invited to talk about what's next after the European Framework for Action, and I will come to that in a minute. But the title of my presentation is about the mental health flagship of the WHO European Programme of Work, because it kind of exemplifies why and to what extent WHO has prioritized mental health in its next 5 years of work. And nothing that I'll be going to say now has not been said during those 2 days. And in a way, it might be a boring presentation because I will repeat what has been said, but I'll try to look at it positively because it confirms that we indeed, regardless of where we sit and what we represent, we all converge in a very firm understanding about why we need to prioritize mental health and an urge that no one can afford any longer not to take action. I hope I can. Yes. So very shortly, the European Programme of Work that was endorsed by the member states of the WHO Regional Office for Europe last year in 2020 has 3 main priorities that are aligned with the WHO Global Programme of Work. The first is moving towards universal health coverage, the second on protecting people better against health emergencies, and the third promoting health and well-being across the life course. And I'm sure all those themes have come over and over during these 2 days. So why WHO and Europe established mental health as a flagship program? Because the suffering, the burden is huge in Europe. Around 60% of Europeans suffer from a mental disorder. And there is a low treatment uptake. You see what is the difference from 7 to 28% for common mental disorders, depending on income level. And you may imagine that more eastward we go in the WHO European region, the highest the treatment gap is. Here I find the moment to remind us all that the WHO European region is huge, it's vast, is a very diverse region in terms of geopolitics, it's very diverse socioeconomically, and it starts from Iceland to the west, to Kyrgyzstan and Tajikistan to the east, and from Finland and Russia to the north, to Turkey and Israel and Greece to the south. So it's not only a very vast geographical region, but it's hugely diverse. And one of our challenges, if not the most important one in WHO Europe, is to maintain relevance. So how can what member states expect from us be relevant from rich and poor countries, from developed and developing countries? And this is why what we say aims at being relevant and resonating with all the 53 member states of the WHO European region. So what were the lessons learned? Now, COVID-19 taught us a lot, taught us about how we behave, and we just in the promotion parallel section heard about how people behave. Do they panic? Do they not panic or so? But one thing is for sure, and it came certainly over and over again, that there has been increase in distress, symptoms of anxiety and depression. There is an increased likelihood of developing mental health condition or worsening situation for those with pre-diagnosed mental health conditions. There has been job loss, income instability, reduced earning potential that all count as social determinants for mental health. And because of all the factors that have been mentioned in these 2 days, there has been a lower access to mental health care. This has been, all this, I need to also give the credit to the WHO Technical Advisory Group for Mental Health Impacts on COVID-19. The WHO convened in the beginning of this year, and that produced a report that highlighted what comes as evidence. We are certain, we know that the evidence continues to be built, so we are learning as we speak, but at least what is for sure is what is there and what has been mentioned in those 2 days. What we have learned in a macro level, we have learned that systems were totally unprepared, mental health systems. So not only we had chronic underfunding, under-resourcing and under-prioritizing of mental health across the WHO European region, but also those under-prioritized and underfunded and under-resourced systems were, of course, not able to cope with a suddenly increased demand for mental health services, for mental health care, for promotion, for prevention. And as we have seen, for instance, one of the certain findings is that following the disruption of mental health services across Europe, all countries had a certain level of disruption, some countries more and some countries less. One thing is for sure, the biggest victim in the whole mental health programs across the region were prevention and promotion programs. So those were the biggest sufferers in terms of disruption of mental health activities and programs. And what can countries, then the question is, what can countries do to ensure recovery and strengthen mental health systems? So this is the big question. Now, what I'm saying now, I say it with humility, because this is not the first time the question comes. I'm sure that you in the Nordic countries, but also other countries in Europe, have convened together in their national context, but international context, to say, what do we need to do about mental health? So this is not the first time. But as I mentioned at the beginning, it's probably very urgent now. And it's so obvious for those who have either ignored because they were not aware, or they could not prioritize mental health, or to some extent there were also situations where a decision maker didn't care enough about mental health. But now it's clear for all that no one can afford not to ensure recovery and strengthen mental health systems. So, to start with, what do we need to do? And our technical advisory group on mental health impacts of COVID-19 by the middle of this year, by June this year, produced 4 sets of recommendations. I'm happy here to salute Kurt Hagquist. Hi, Kurt. He is one of the most active members of our WHO technical advisory group on this. So you see, the Nordic experiences were represented in this group. I'm not going to details in the recommendations. You can find them in WHO website, but mainly the recommendations concerned the needs related to the general population and communities. These recommendations are as per the themes that our TAG, the Technical Advisory Group, identified. The second is groups particularly affected. Now, sometimes you'll hear us talking in the slang of vulnerable groups, and I'm trying to avoid this wording, because we don't want to categorize people from their vulnerabilities rather than from the need to have a tailored particular attention because they were particularly and badly hit. And here it's, if I can mention that those vulnerabilities some were old and some were strengthened because of the pandemic and some were new. We never before had health workers considered among the groups most affected or most at risk or most vulnerable, but suddenly we have to health workers, health and care workers. What were the impacts on and the needs related to mental health services? There is a common understanding in this room and beyond that mental health services were severely disrupted, less disrupted, but moderately disrupted, but which prompts the need for action to address that. And last but not least, mental health impacts of COVID-19 on the health and social care workforce. There were instances where healthcare workers abandoned their post because they were overwhelmed, because they were not supported, because they felt exposed to infection, they felt exposed to overwhelming and insufficient and inadequate and inappropriate working conditions, so that many parts in our region were left to scratch their heads about how to fill in the void left by overstretched health workforce. Now, all this awareness and what had been built before, the lessons learned about why mental health reforms across our region failed, to some extent. Some countries have gone much ahead. I was talking to Christian and Taru yesterday, saying between now and 15 years ago in Finland, there is a huge progress, and so it is in other Scandinavian countries. But in some other countries, even though they probably developed good policies, good legislation, their reforms did not go as much ahead as they were intended because of certain reasons. So those reasons were well analyzed and were combined with the lessons learned from the COVID-19 impacts on mental health. And here we came with the document that is now called the European Framework for Action on Mental Health, which mandate goes up until 2025. It was widely consulted with our member states, and I want to find now the moment to thank Finland. The Finnish representative in the consultation gave us a very good vote of confidence when they confirmed that this framework for action is very much in line also with what Finland is trying to do. And also all the Nordic countries, through their consultations within the EU, gave also a great vote of confidence in the Regional Committee for Mental Health for WHO Europe last September, when they gave a huge support to this framework for action, so all the EU member states. And the framework for action has concrete objectives and actions to transform mental health systems. And please notice here, we are talking about more than mental health services, because it's about systems that we aim at transforming. It is aligned with both the WHO Global Action Plan, but also with the European Programme of Work. And as I said, it received a resounding endorsement. The transformation, we aim at achieving transformation through leadership, through advocacy, through data, through mental health literacy. And again, for the sake of time, I'm not able to go and into details about each of those, but I hope and I'm sure that you will see how this resonates with a lot of what has been said in these 2 days. So when it comes to the strategic priorities, as I said, we stemmed from the strategic priorities of WHO Europe in general. And how do they translate in mental health? So what does it mean when we say moving towards universal health coverage in mental health? It means mental health service transformation. So it's not only and mental health service transformation can be approached through a number of entry points. It can be approached from policy. It can be approached from standards, from guidelines, from mental health financing. And this is how we want to have really a very comprehensive view of how to transform mental health services. How to protect people against health emergencies in mental health, and it was mentioned yesterday, I think. It's by integrating mental health into emergency preparedness, recovery, and response plans. And the third is how to ensure healthy lives and well-being for all at all ages is, of course, through mental health promotion and prevention. In terms of mental health service transformation, Strengthening mental health service delivery, building up mental health workforce. It's not only about making sure that there is a comprehensive, interdisciplinary mental health workforce, but this mental health workforce is empowered to do what they need to do. In some instances in our regions, we have still very obsolete power balances within mental health teams that need to go. And this is, when we say build mental health workforce, is not only about training, what you do better or what is the newest in science, but it's also about changing the culture attitudes that are obsolete and prevent participation of all in delivering mental health. Improving mental health financing, as I said, mental health is chronically underfunded, and it's not only about the total level of resources that you allocate to mental health, but it's also about how you distribute that. Because we still have a predominantly hospital-based allocation of resources in our region, and this needs to change. And scale up digitalization. COVID-19 showed us that it is possible, that we can be innovative, efficient in using digitalization as a way not only to improve quality, but also to improve access, so to be more accessible and affordable at the same time. What does it mean to integrate mental health into emergency preparedness and response? I think this picture speaks 1,000 words. This comes from Ukraine. Mental health outreach, mental health community teams in Ukraine were visiting people at home during the pandemic, aware that the traditional way of how you access services had failed. So we need policy actions, first of all, to include mental health into the government plans, but also we need then technical actions. We need to qualify our people. We need to let also the frontline health workers be protected also from the mental health burden. They need support, mental health support themselves, but they also need to have a training component of integrating mental health when they are at the front line giving services and holding the hand of someone that is dying alone in the ICU. It's detrimental for everyone that has been exposed to that situation. So they need support. Mental health promotion and promotion and protection. I'm sure everybody here will agree that it starts with programs to support mental health of children and young people, mental health literacy promotion, mental health of older adults, mental health in the workplace, and suicide prevention. And please notice here that when we say mental health, we actually include both mental ill health, but also well-being. And I think this is the paradigm shift now, if we talk about the whole WHO European region, that it's not, and it has been talked yesterday especially, that it's time now to approach mental health from the well-being angle, because as it has been said over and over again, well-being is no longer a privilege, but it's a right. So how to operationalize? One instrument that in WHO, that we in WHO are striving for developing and sustaining is the Pan-European Mental Health Coalition that was launched in Brussels on the 30th of September this year, and which purpose is to empower member states to act on strategic priorities. Why did we need a coalition? Because you might say, but you're WHO, you convene member states. You have annual meeting of ministers and many more ministerial meetings in between. But it's not only about ministers. As it has been said all over again these 2 days, we need so many more partners. And we need the usual suspects around the table, but we also need those that were never before called on into. Nordic countries have probably better experience with working with employers and labor organizations when it comes to mental health in the workplace, but such is not the practice elsewhere in the region. And this is what we're trying to do. We're trying to bring all those that were before neglected, but that could have a voice, that could have energy, that could have resources, that have the expertise, that have the capacity, that have expertise both as professionals, but also by lived experiences. And of course, it needs to involve also the big ones, the European Commission, the UN organizations, those that really move international agendas ahead. We'll continue to rely on our WHO collaborating centers, on experts like Professor Haqvist here, and on civil society, of course, private organizations, and not only. And there are 7 work packages aligned with the priorities that will be developed soon next year. We are talking about with the partners now, and those will be finalized early next year. Following the Commission, the WHO European Commission on Health and Sustainable Development, there has been, the Commission came with a report that called for putting mental health at heart of a sustainable and resilient society. And of course, we need a whole of society approach because whole of society is affected. And I don't need to give you evidence. The evidence has been given these 2 days. And it must empower and mainstream existing mental health infrastructures. And we had a talk yesterday in our parallel session with David McDade when we discussed about the risk now that because COVID has repurposed a lot of mental health facilities, the risk is that this budget is taken away for good. And we need to go back and keep the budget, add more budget, but of course reorganize that in favor of innovative services, community-based, primary healthcare, think of services that are close to where people are, as opposed to asylums, institutional care. We need to diversify innovations in terms of care modality, technology, perspectives, and so on. And I was really listening those 2 days to the inputs 2 days. They really feed very well into this item. Research and systematized data will be drivers of action, and I want to stop here a bit. In WHO Europe, we have, because of the diversity of our member states, we have a problem with aligning data because the data collection and analysis capacities of our member states differ from one member state to another. Some countries have more capacity and in terms of both number of people, but also skills and competencies to collect and analyze data, and some countries are less resourced in doing so. And therefore, data that come to WHO is not necessarily comparable all the time. Sometimes you will see in WHO world reports or European reports that you have blank points in the map. Some countries don't even report. So in order for us to be able to not only implement what we're trying to do, but also to measure what we're trying to do, we need solid data systems. And therefore, in WHO, we're trying to support the development of a mental health data lab that we'll develop it in the short run, but in the medium run can start comprehensively, systematically, comparatively collect, analyze, and provide data for policy, for evidence-informed policy making across the region. So, one of my last slides, I know I'm running out of time, funding mental health, it's important. And I mentioned it's not only about how much you fund mental health, and usually mental health is the orphan of many other topics within health. So traditionally mental health receives less resources, but it's about how you distribute that. Do you have how much, what is the proportion of mental health budgets for primary care interventions, for prevention and promotion, for qualification of mental health workforce? So how do you distribute that? And of course, member states are best suited to understanding their individual needs. We are not preaching a one-size-fits-all because, as I said, our member states are diverse, but we are wanting to build upon the diversity and develop upon that, and also to fund innovations because, as I said, COVID now made it abundantly clear that we not only can afford innovations, but we should do. So it's no longer a matter of I choose or not choose, but it's a must. The small diagram here, I think it's very small for people people to see, but it's an effort we are trying to do to simplify the action, how the actors will connect to each other. So who are the main players and what are the main instruments, the main directions that we will, so what is the what's, what are the how's, and what is the who's. And if the organizers will distribute this material, then you will see the diagram for yourselves in the material. Before closing, I want to also remind us that no matter how challenged we feel about moving things ahead, we need to also realize that this is an unprecedented year. Never ever before we have had a series of such high-level events in such a short period of time. In less than a year, it's actually in 9 months only, we started with a meeting organized by the Commission, by the European Commission, a high-level meeting on mental health and the pandemic, and it was titled Living, Caring and Acting. And I think Nicolene, the colleague that will follow after, she was behind the organization of that event on the 10th of May. Then in July, we had the WHO/Greece, so WHO and Greece jointly held event, summit on mental health impacts on not on the impacts, but how to address the impacts, so how to come with solutions. Then G20, when in their meeting in Rome in early September this year, dedicated a ministerial meeting to mental health alone. So just the day before, the ministers came together and talked about mental health. Then we had the regional committee for WHO Europe, where the European Framework for Action was endorsed. Then on the 30th September, we had the launching of the Pan-European Mental Health Coalition. In Paris, the government of France hosted the global summit on mental health that was aptly titled Mind Our Rights Now. In November 2018-19, here we are in Helsinki, a lot of us from all the Scandinavian countries talking about mental health. And the other interesting news is that the French presidency of the Council that opens on the 1st of January will have its first ministerial meeting dedicated to mental health. So never before, colleagues, there has been such a high attention. And in between, what I didn't mention and what you don't have here is that there have been two very important reports published. The WHO Mental Health Atlas that was published in around the Mental Health Day, and the UNICEF World of Status Children that was published around that day, that was dedicated to mental health of children exclusively. So let us stop a moment and appreciate the fact that this line alone gives us hope that the momentum is now, and it's an opportunity that should not and cannot be wasted. And all of us can put a little brick into this big establishment of mental health in Europe, in the world, basically. And with this, I thank you very much for your attention and thank the organizers for inviting me.
Thank you. This is now it's working. Yeah. Thank you so much. It gave a good picture about the European level activities, which surely will be very valuable for all of the member states in the efforts to promote mental health. Now we can be a little bit flexible with the timetable because lunch is the next one in the program, and therefore I give now the floor opportunity to take up the floor. Questions, comments, and here in front first, and the back. The second question or comment, please.
Excellent presentation. That was truly very good. One comment and one question. The comment, you made reference to mental health being the orphan of health, and there's a famous Canadian who has coined the phrase that child and youth mental health is the orphan of the orphan. So if we're talking about distribution of resources across a continuum of care, I think we can't underestimate the value of an early investment in wellness, and that should always be a priority for us. The question is that I'm increasingly aware that philanthropy is starting to organize internationally, particularly philanthropy that has a focus on mental health. To what extent are the activities of the WHO and its partners been trying to align with the similar conversations that are happening globally from philanthropy?
take all the questions first, if it's all right.
Okay.
Yeah. There's one back there, yeah.
Hello, hi. My name is Dominika Borodska, and one of my many occupations is being a nurse in a pediatric unit in psychiatry in Brussels. And I just wanted to highlight and thank you for saying that there is a crisis also among the staff. 2 months ago, when I left my unit, we had to close 4 beds. Out of 15, so a big percentage. And yesterday I got to know that they had to close the unit for the weekends. So all the children have to go back home and then only come back on Mondays. What can we do with this lack of motivation? Because the why this is happening is actually because of there is not enough staff working with the children. In nursing and in therapy. So what can we do with that? How can we help us becoming a better carers for the youth and maintain the motivation? Yes, thank you.
Yes. Thank you. If I may start from the second question, it is indeed, and if it happens in Belgium, that is one of the countries that has is well resourced, and I'm mindful of the fact that again WHO European region is huge. You can imagine how challenging might be for those with less resources. But one of the there are many factors of satisfaction of healthcare workforce, and salaries are not the only one. So it doesn't matter. So it does matter, of course, the level of the salary, but respect is the other, and career opportunities. And especially if people are brought into among the factors, they are not the only one. But if people are brought to a situation where they feel their work is not appreciated and that there are no career opportunities and they are destined to retire in the place where they started their career, there is not much motivation. So the first crisis will make them snap and go and look for other avenues. And I think the response, the answer here needs to be very comprehensive. We cannot have little things increase the salary. I think there are many governments now in Europe that are trying to address this through increasing salaries. But this is a narrow tunnel vision approach to a fact that has deeper roots and older roots. So, and especially because you belong to the nursing profession, there is power balances are there, and they are there to stay for a while. So, in terms of motivating staff, we need to also change the service culture, and it needs to start with the education of our medical professionals. Be those doctors, be those nurses, psychologists, because what we have seen in mental health, for instance, is that we, to some extent, managed to bring new professions into the mental health teams, and then we saw that psychologists became the new doctors. So a kind of power dynamics were added, and this is something that has to do with how people perceive the culture. And you mentioned in the morning, no, how you look down at those who benefit from your so. It's a very complex answer. Can I give also an answer to the question before Frederick? Yeah, because he also wants to ask something. Thank you for mentioning children and adolescents' mental health. It's actually one of our 3 key signature initiatives, and we are trying to also partner with some member states and to increase some funding so that we can approach child and adolescent and youth mental health in Europe with more solid resources and capacities. So rest assured, please, WHO is hugely concerned with that. And in terms of philanthropic, yes, the European Pan-European Coalition is aimed at including also.
So